Hi, Harry, and thank you so much for talking to me today. Can you just explain about how your learning disability impacts your daily life?
Yes, of course. Um, my learning disability impacts on my daily life because of the discrimination, the barriers people with a learning disability face, and and we face high level of discrimination, and it still exists today in 2021.
Mm.
This is really wrong, and I think in most recent over the last year, since 2020, since the COVID-19 pandemic, people with a learning disability faced more high level discrimination, and they haven't been prioritized for like issues like the coronavirus vaccine. And it just felt like when the government are not listening. For example, Prime Minister Boris Johnson and the Health Secretary Matt Hancock is not listening to us.
Right. It
And I think this is the challenges people with a learning disability are facing because of and healthcare is one of them.
yeah, yeah. And how has the pandemic affected you?
The pandemic affected me because um, I'm not able to like do the things I like doing in an ordinary society, and I feel like the world has like turned against like all of us really
Right.
because of coronavirus. And the rules are just so confusing because they keep changing all the time. It's just like this the thing, it's difficult to get your head round the laws, and they're so overwhelming
Yeah, yeah.
because of COVID.
And how do you feel about vaccines, particularly vaccines for learning disabled people?
um I feel vaccines, the COVID-19 vaccine is really important because they should be prioritized for the vaccine because people with a learning disability have other possibly having like other medical health conditions.
Yeah.
Like for example, it's like people with a learning disability are more likely to die from COVID that, that than others because of people with a learning disability need the vaccine so they can keep themselves safe, so being at high risk. And also people with a learning disability will be able to go out a little bit more for like essentials, like food essentials, and like, for example, buying a magazine from a shop or food from the grocery store, just to get themselves out the house and make themselves like feel good, even if it's just for about an hour or going on very short walks as well. It's just a lot of people with learning disability are not able to do these things because of the high risk category.
Yeah. So within the pandemic, you're calling for vaccines to be rolled out to all learning disabled people, aren't you?
Yeah,
And do you think that society needs to change generally in terms of how learning disabled people are treated?
it needs to be changed generally. Yes, at all costs. Healthcare, employment, education. We need to see a more inclusive life for people with a learning disability when the pandemic is over. So I would like to see this as the start of it's like us getting the vaccine being prioritized for that, and then once the pandemic is over, the next stage is to be prioritized to build a positive world where people with a learning disability are living in an inclusive society.
Yeah.
That's the positive change I want to see after the pandemic, because there's a campaign called Build Back Better. And I feel that learning disability must be part of the Build Back Better campaign, because we talked about like it's very positive. Cycling is in that agenda, which I'm very passionate about as well. but I want to see more people with a learning disability being part of the Build Back Better campaign, because they could have a lot of more opportunities after the pandemic is over.
Mm. Mm. And if you could sit down with the Secretary of State for Health and Social Care or with Boris Johnson, what would you say? What would be the first thing that you'd want to tell them about living as a man with a learning disability?
Of course, yeah. Um, as a- as a person with a learning disability, I would say Prime Minister and Health Secretary. These are the important issues that the government must deliver for people with a learning disability. The vaccine is very important for people with a learning disability and should be prioritised for the vaccine, because people with a learning disability have high risk health conditions. And that's why us getting the vaccine will be really, really beneficial, because 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 if they get the vaccine, they'll be more likely to be like safe going to the shops for essentials like groceries, or even for short walks, or just getting out just for a little while. Even though we're in a pandemic, we still follow the rules. It's just getting out for like essentials and getting out for a little while, because people with a learning disability like to go out because it's good for their mental health and make themselves feel good. So that is my challenge to the Prime Minister and the Health Secretary. That's why I feel like they really need to act on this right now and turn a corner, because we've been campaigning on this for weeks now and we had no response. And I just feel like it's been very disappointing. There's we keep challenging them, and it just seems like they don't want to listen if they're hearing me. But I feel like now is the time we be heard respectfully. So I am asking the government, especially Boris Johnson and the Health Secretary, Matt Hancock, to respect what I'm saying. I think it's not just challenging them, it's just respecting our health issues. So it comes from challenging them to asking them to show a little bit of respect.
Yeah, absolutely fantastic. And
because we try and show respect to our government as much as possible. We all try to support them with what their agendas are if we can. Even if we don't agree, we do try it. Most of the public do want to try and support them with their plans.
Absolutely.
But it's very important they give back and support others with their plans, because we support your Build Back Better campaign and what's in it, but part of this part of this is giving something back, giving something for people with a learning disability, the vaccine. So we're supporting them with the Build Back Better campaign, which we do support, and we support them with that no matter what, just to give them a little bit of clarity. But they must give back to people with a learning disability to be prioritised for the vaccine, and it needs to be done. So we support you with Build Back Better, but you need to support us back as well, because it works both ways.
That's right. And we saw with other campaigns, because you're fantastic on social media and you've been talking about the very sad statistics of the numbers of learning disabled people who have died from COVID-19.
Yeah.
And we've seen with other campaigns on social media highlighting other forms of injustice that have happened, like, for example, Marcus Rashford's amazing Feeding Children campaign, ensuring that children are being fed while schools are in lockdown. And I see what you're doing as exactly the same. It's just saying governments can't know everything. but they do need to represent everyone. And so highlighting with them perhaps where they're not necessarily understanding what learning disabled people are saying or needing more.
Of course, yeah.
I think is fantastic what you're doing.
Thank you so much. I appreciate what you're saying. Yeah, really appreciate it.
Well, it's fantastic. So, and thank you, Harry, for talking to me today. That's just been brilliant.
No problem at all, Nicola. It was my pleasure.
I guess the first thing to do is to ask, sort of from your perspective, where we are with vaccines and learning disabled people.
It's a great place to start. As you are aware, Nikki, Mencap and many other disability charities and family campaigners and others have been calling for some weeks now, ever since the Joint Committee on Vaccination and Immunisation put out their priority lists and priority groupings for the rollout of the vaccine. We've been campaigning for all people with a learning disability, full stop, to be included as a priority on that list. Mm-hmm. Currently, as the way things stand, the JCVI, the committee, have put people who have Down syndrome into group 4 for the priority for the vaccine, and people that they describe as having severe or profound learning disability in group 6. We have some real issues with that latter definition and how it's been come up with even as a concept, and also what it means in practice. But more importantly, we want them to look at the statistics that were gathered by Public Health England and others in the first wave of the pandemic, that show so clearly that if you have a learning disability, full stop, you are up to 6 times more likely to die if you get coronavirus, and in the 18 to 34 age group, you're up to 30 times more likely. And we think these are statistics that they really just should stop ignoring.
Yeah, I mean, they're shocking. And can I get, at this point, can I just sort of, an interesting point that I've seen raised a couple of times now is that there seems to be a little bit of confusion. I don't know whether it's amongst the public or the government or who it is, but the idea and the conflation of learning disability with learning difficulties, which are two completely distinct things and affect different groups of people in completely different ways in terms of the risk factor.
Yes, absolutely. And those of us that work in the field of learning disability, or indeed have a loved one with a learning disability, I think we all get quite frustrated when that learning difficulty is used to describe what is, a very real and often challenging disability for someone to live with. And we have no evidence to prove this theory, but through conversations with senior civil servants, with government ministers, including a press statement that came out from the Department of Health and Social Care, where they described, in response to our campaign, people with learning difficulties. So we do wonder if, because of course this is a volume game, and we do understand that lots of groups by profession and other such groups are lobbying at the moment to be pushed higher up the priority list. And we do wonder if the committee have thought about learning disability or are misunderstood about what it actually means, and have included numbers of people, or are worried that they'll open the floodgates to people who would be described as having a learning difficulty. So, for example, people with dyslexia or people with ADHD. And of course, there's no data to suggest they are at any higher risk. So we do wonder if that's a factor, but I don't have any evidence to sort of prove that theory.
And I think the other thing that needs to be specified from the reading that I've done, when you look at something like the extremely clinically vulnerable list, as you said earlier, there's Down syndrome, but underneath that on the list, it says severe and profound learning disability. And that's tier 4. And yet, again, for example, my local authority, learning disabled people are in tier 6. So it just seems to be a confusion, and also a sort of misunderstanding that somehow, dependent on the point at which your learning disability affects you, whether it's mild, moderate, or severe. And the thing that I've heard you brilliantly, the point I've heard you brilliantly make several times is it doesn't matter how your learning disability affects you, to whatever degree it's deemed to affect you. This is affecting learning disabled people equally.
Absolutely, and I can't stress that point enough. The data that's been collected during the first wave of the pandemic and beyond doesn't break people down into those artificial, I think, or arbitrary definitions. The data just tells us that if you have a learning disability, however it might be defined as mild, moderate, severe, and I personally have issues with those definitions anyway.
Yeah.
Because often someone's learning disability and how it might affect them is dependent on the circumstances that they're in, or the context that they're in. And my own son, as you know, has a learning disability, and if he's in a very safe environment where he's not got high anxiety, then you would maybe suggest he's got a mild to moderate learning disability.
Yeah.
If he's in a different environment where he's exhibiting some difficult behaviors and very anxious and upset, you would describe him possibly as having a severe learning disability. So the definitions have some purpose when you're thinking about the support that someone needs to live a great, happy and healthy life. But in the context of who should and shouldn't be given a priority for the vaccine, I think the definitions are bordering on useless. They're certainly irrelevant. And we know that on the learning disability register, and when GPs are asked to note a person's learning disability, they don't use those definitions. So we're at a loss as to where the JCVI committee came up with them in the first place.
And as to whether, my confusion as well, I think, is as to whether they're being applied. We know that the government are taking scientific advice and that they are basing their decision making on categorizing who is eligible at what point, following the science, and the JCVI are advising, but ultimately that's a government decision. Really, is it? Or how is it? It's just so arbitrary. I can't pretend to understand it. And I'm also not saying that you have all the answers to that, but I suppose I'm trying to make sense of it when we know how many people are at risk and aren't covered from these tiers as they stand.
It's very hard to reach the people who are ultimately making these decisions. But certainly through all the conversations I've had personally, and Mencap has had with government ministers, with senior civil servants in the Department of Health and Social Care, and people representing the JCVI committee and the Deputy Chief Medical Officer, they push back every time really when we lobby on the priorities being placed, or the priority being placed on the people who are most vulnerable. And of course, they're looking at age, which we all understand. They're looking at care settings, which we all understand. They're looking at the NHS and social care workforce. And then they seem to stop. And in the case of learning disability, however often we produce the data and the statistics and push it really in front of them, they do seem reluctant to budge. However, there is some good news, and there is some light. Because what we're seeing in England in particular is some clinical commissioning groups are taking a decision locally within their trust area to offer the vaccine to all people with a learning disability as a priority. And we're also seeing in many cases in England, GPs are using their discretion in the context of both the person with the learning disability and the family carer. Yeah. And we're also having some very positive conversations with NHS England, and we hope to see some progress on that in the very near future.
That's fantastic, because that was going to be my next question. What are you calling for from government? But it sounds like it's almost being applied locally, sort of not stepping away from overall government guidelines or guidance, but people are now making their own decisions because they're the practical and right thing to do, I guess.
Yeah, I think that's what we're seeing, and partly because, as we said already in the conversation, the severe and profound learning disability definition doesn't really exist in any way that GPs or others can measure who should and shouldn't be on the list.
Yeah.
And so, I welcome the fact that there is some local discretion being applied. And one of the arguments that we've put across right from the start of the vaccine rollout is that we're talking about relatively small numbers of people. Because again, I understand both politically and from the committee's point of view, they don't want to push certain, groups of people or individuals higher up the list, because that obviously means that others, have to wait their turn.
Yeah.
But we're talking about huge numbers here. We've estimated in terms of numbers in England, it would be 100,000 to 2,000 additional people. And therefore, it would make the vaccine rollout much simpler in the context of learning disability, because no doctor or medical professional or care manager who's already under enormous pressure at the moment is having to sit in a room and make a decision about whether this person with a learning disability should have the vaccine or not. So we
It's
think
unimaginable, isn't it?
yeah,
That
if it
pressure
just
being put
included
on
everyone.
you. Yeah.
Yeah.
So obviously for many learning disabled people, they're living in their own homes, so they have community placement, again in residential placements, and I don't think it can be overstated, because I think there's this misunderstanding about who lives in residential care in the UK, and that is predominantly elderly people. But you also have a large number of learning disabled people who live at home or with family carers. So what's the position there for family carers and vaccines?
You're quite right. There are, of course, people with a learning disability, adults who live in care homes. There's also many people with a learning disability who live in residential sort of supported living type accommodation. But there are, of course, the same as everyone else in the population, many people with a learning disability who live at home and are part of a family unit. And again, at the moment, family carers are not in any of the priority groups. And we are seeing this conversation happening in the context of older people and their family carers. But we continue to say that all people with a learning disability should be on that vaccine priority list. And therefore, it would make perfect sense, because in most cases, they would need to be accompanied to the vaccination centre by their family carer. It would make perfect sense to offer the vaccination to the family carer at the same time as they are giving the injection to the person with a learning disability. And then, of course, you have got the issue around infection control. So if someone in the household is vaccinated and their main carer isn't, especially when it's a family carer of someone with, a profound learning disability, what happens if their carer contracts coronavirus and has to go into hospital? That opens up, obviously, a whole range of issues about care for that individual, care and support.
Yeah.
So again, we would say it's common sense, and we do see some examples of this happening in practice, again, because local GPs and vaccination centres are using their discretion when handing out the vaccine.
So what do you feel is the solution to this, especially the confusion? Because there does seem to be a lot of confusion and sort of misapplication and varying sort of degrees of whether it's difference between individual GPs or it's almost a postcode lottery. So do you think there is one solution that if government adopted it tomorrow, it would make an enormous difference?
I think it's, well, I don't want to use the word unlikely, because we are ever hopeful, but it's looking unlikely that the JCVI, the committee, are going to change their mind about the priority groups, especially as we start to move into groups lower down the highest priority group, if that makes sense.
Yeah.
So I think one solution to this would be some statement or letter or something that is distributed by NHS England and indeed the other countries in the UK, that people with a learning disability and their families, and whatever setting they live in, could take to a GP practice, and say, we are self-referring, if you like. And these are the reasons why we think we should be on a local priority list for the vaccination. So I'm hoping that we can have that kind of statement, or that letter, or that tool, if you like, that individual families and people themselves can use to self-refer, because that's one of the frustrations at the moment, and we hear this a lot through the Mencap helpline, is we're not clear who is making the decision, and it's back to the point about definitions. And so it's very frustrating when you can't even speak to someone to ask the question, is my son, is my daughter, is my brother, is my sister on the vaccine priority list, to be told just to be quiet, go home and wait for a letter. So we're hoping that there will be a system, or some type of system, around self-referral. That's what we're pushing for at the moment.
Okay. Edel Harris, CEO of Mencap, thank you so much for talking to me today, and for all the work that you're doing, because it's not easy, especially when you're not necessarily getting the hearing I think that perhaps you deserve. Just keep going with it. But thank you.
It's too important an issue not to keep going. Thank you.
Thank you.